Every patient who walks in the door, regardless of what their needs or concerns or condition, is taken care of in such a way that they know that they can count on us to be looking out for their vision and health. We have the ability to provide a very high level of service and care to patients that they really can't get elsewhere. As the newer technologies come along, we're large enough to be able to purchase or lease those technologies to make them available to the patient. So in some ways, our size allows us to give benefits to the patient that they couldn't otherwise find in any other setting. The multiple locations provides convenience for patients, and the fact that many of our subspecialty providers will travel between location makes it easy for a patient who's comfortable going to their neighborhood OcuSight's office to obtain subspecialty care because the specialist actually will come to them. We refer within the group to come up with the best solution and alternatives for them so that they can have a good outcome and maintain their vision throughout their lifetime. Many eye diseases exist, but they don't necessarily have to cause sight loss. And by diagnosing these problems earlier in their stages, we can help navigate the patient through recommendations, whether it's nutrition, surgery, laser, or medications. We can try to keep them, even with their condition, with good vision. They don't have to lose sight to some of these problems. Many patients are more comfortable buying their glasses where they have their exams, and the advantage that we can offer the patient is because we own the optical shops, we can provide the service to them, and if they have any problems at all, we can correct those problems easily. The goal of all of our cataract surgery nowadays is to provide patients with uncorrected visual acuity that will allow them to do any task they desire, whether it be driving, reading, cooking in the kitchen, doing sports. They are able to come out of cataract surgery with uncorrected visual acuity that allows them to do all these things to a higher level than they've ever done before in their life, regardless of what their spectacle corrections might have been for their entire life. We have a huge patient population with significant systemic diseases, including diabetes, blood pressure problems, a lot of patients with rheumatological problems. We see and screen those patients because the exam of the eye is very helpful to their internist or their other subspecialists in knowing how well controlled their problem actually is and whether or not the problems are having effects on their other organ systems. So we communicate very closely with our primary care physicians as well as other specialists as far as how the patient's eyes are reflecting their medical condition in general.